So now we're going to talk about ways we can tackle the problem. And if you remember, we talked about 3 elements of the cognitive framework or the cognitive map, so to speak. And one of those was the salient features of the problem. We just discussed those. The second was the local and global context. And now we're turning to ways we can tackle the chronic diseases and risk factors. So I'll jot down tackle the problem up here. And if you recall, when I initially introduced this component, we drew a large rectangle. And so we're going to do that right now. And this is just going to be a visual way for us to organize our thinking around those main categories. And we'll just talk for a couple of moments about each one. So the first is R&D, or discovery and development. So for example, we have scientific breakthroughs that help us understand the natural history of a disease, and that then leads to better ways to treat that disease. So that's one example of discovery and development. Another might be translation of science to actual products and technologies that can be used, medicines and drugs. So if you just consider the medications and the drugs for heart disease, or diabetes, or cancer. Those are all innovative responses in discovery development science. The second category that we're going to spend some time on are health systems. And so by health systems, I'm broadly referring to both the public health system and the clinical care system, if you're used to thinking about those separately, but I'm really thinking about the entirety of that health system. And we spoke already about the 3 goals of the health system, as well as the functions of that health system. And we acknowledge that even though those functions are interrelated, we're just for convenience going to list those functions so that we keep them all in mind as we continue to talk in more detail. And let's go ahead and remind ourselves, well, delivery of services was one important function. Maintaining a health workforce, so that of course doesn't only refer to doctors, but all health providers or community health workers that are in the health system, so workforce. Products and technologies. Supplies. Information systems, and that includes collecting data and having the capacity to interpret that data so you can continuously improve your health system. Finance, and how you're going to pay for it and sustain it. And then finally, I'm not sure if I did this on purpose or not, but I didn't draw the box large enough for one of the most important and neglected functions, which is stewardship and leadership. And I'm going to add 2 little points that we haven't discussed before for you to keep in mind for this particular module as you think of these functions. And I'll just write them on the side, but one is quality. So inherent in these functions is, of course, we want to deliver quality of services, but this is really a hot topic on how we achieve getting quality of care and how do we measure whether we're delivering quality of care. And the second I'm going to just jot down on the left is a comment about stewardship. And in this globalized world, part of stewardship, part of thinking about leadership of the health sector is thinking about the responsibility for cross-sectoral communication. So when we start to talk about social responses outside the health sector, it reminds us that those sectors need to talk together in order to combat health problems. So those 2 reminders are 2 additional pieces of information that we're now adding on to our discussions of the health system. Well, just a few moments ago, when we talked about the nature of chronic diseases, we drew that long line and we showed in utero all the way to adulthood and the elderly, and that was that long lifespan. And that's a good moment for us to think about the levels of a health system. So we're going to need to have different levels in order to intervene at different time points. So right here, I'm just going to draw a little picture that's going to remind us that there's a community level. And we also draw another little picture here. And let's just say that's our clinic. It's our primary care level. And then, of course, we can make a tall, kind of larger building. It's not drawn to scale, but that's okay. And we'll call this our referral center or our tertiary hospital. You'll be hearing more about that later in this module. So when we think of these three levels of care, we can also think about the kinds of interventions we can deliver. So for example, in the community, you could imagine there being community health workers or educational interventions. We want to prevent kids from starting to smoke. In a clinic, in primary care clinics, there might be screening for high blood pressure or for high blood glucose so that patients or people that have those conditions can get treated, and that can be secondary prevention before they develop the disease. In the hospital setting, we can think about treatment of cancer, advanced treatments for heart disease, handling the complications of diabetes. At all three of these levels, there will be considerations for financing, delivery of quality of services, having an adequate workforce, and there'll also be gaps and entrepreneurial opportunities for good ideas on how to make this system work better. So let's turn to our third category, and I'm going to put up here social policy. And of course, I'm referring here to all of the different kinds of policy instruments or actions we can take outside the health sector. So when we think of the problem of chronic diseases, one of the most policy sensitive actions that we've done has been regarding smoking, regarding tobacco use, and that has been price change. There have been others, but that's one of the levers we've used. So one type of change outside the health sector could be price changes or taxes and subsidies. And that's, of course, not only referring to tobacco, but could be on other unhealthy products. Another type of intervention outside the health sector in this domain might be laws and regulations. So when you think of the laws we have to prevent smoking in restaurants or secondary exposure to secondary smoke, or you consider if you are a particular state in a particular country that has put a ban on filling large sodas, those kinds of policy interventions or laws can be another way to prevent exposure to risk factors and help mitigate the burden of chronic diseases. Another might be regulations for food, trans fat, etc. And another might be policies that aren't quite laws, but for example, when we have a big push to remove soda from children's schools, or we have a collective community group that is thinking about intelligent urban design. Those are also the kinds of interventions we can have outside the health sector that can have an enormous impact on the risks and the development of these chronic diseases. The next category is social entrepreneurship. And here, I'm not going to talk much about this right now, and I'm going to just write in large red, stay tuned, because Tarun is going to talk about this. And this is a good reminder, though, for me to remind you that different interventions and different entrepreneurial interventions may be within the health sector, but they also may be broader and actually touch on interventions outside the health sector. So for example, I think I said this to you before, but the idea of microfinance is certainly an innovation outside the health sector, but has enormous potential as a lever to improve health through many different vehicles on these social responses. And so our final category is global governance. And you remember that global governance is the organized social response to health problems that we have at the global level. And we could distinguish global health governance amongst the actors that are primarily focused on health. And we can also think about global governance for health, which would be actions, for example, in trade, investment, that are at the global level, but they're outside the health domain, but have an impact on health. And so we'll just provide a couple of examples in the interest of chronic diseases that would be relevant. And probably the best example is the WHO Framework Convention on Tobacco Control. And we've provided you with some resources to read about this. And this is considered a treaty. Of course, about 177 countries have now ratified. And what a treaty is that we've loosely agreed as a global community to several recommendations that we feel would achieve reduced burden of disease due to tobacco use. And they range from suggestions on price changes to suggestions on or regulations on how we advertise and what warnings get put on cigarette packs. And there's a host of other components of that treaty. But that's one example that is a global response to a particular risk factor for the chronic diseases. Another, if we just think back over the last couple of years, the UN General Assembly adopted a political declaration nicknamed 25 by 25, which is a set of interventions aimed at risk factors mostly, but also some treatment recommendations that would aim to reduce the mortality of the four main chronic diseases we've been discussing by 25% by the year 2025. And that's another type of intervention at the global level aimed to have an impact at the national level within nations on these risks of chronic disease. So a good way to wrap up this broad spectrum of how we might tackle chronic diseases and segue into a really interesting case that Tarun is going to talk about is to remind you of the goals of a health system, the primary goal, and that is to improve health and the distribution of health, to protect families and communities from financial catastrophe, from those health expenses that will push them over the poverty line. And third, to meet the needs of the patient, who is also a consumer, who is also a payer, a financer, who is also a citizen with certain rights, and is also a co-producer of health, who has to participate in providing health by the actions they take and by seeking health care when appropriate. And one of the features of the case Tarun will talk about is that as most social entrepreneurship goes, there's broad thinking about how to leverage all components of society and integration with communities and empowering people to mobilize an effective response for a particular problem.